Hi there, are you looking for a good MBBS course? Is it your dream to become a doctor? Then, you are in the right place. We shall help you to achieve your dream.
There are 5 criteria that you must have inside you. The first criteria for becoming a doctor should be that you really want to help patients. How do you know that you are the one? It helps if you have spent time with a physician. It helps if you have worked in healthcare. But ultimately it really is a personality consideration. Do you have a passion, want to help others? Then you should consider becoming a doctor. The second criteria for becoming a doctor is that you enjoy the mental processes involved in doctoring. As doctors, we solve diagnostic puzzles and use our knowledge to determine the best treatment options. Excellent doctors continuously expand their knowledge. We learn from our patients. We decipher their stories, examine them, and combine those activities with the tests we order. Then we persist in the thought process, following the patient to be certain that our assumptions are correct. The third criteria is humility. We are never as good as we would like to be. We will make mistakes, hopefully not major ones. We must own those mistakes and correct them if at all possible. As new information becomes available, new symptoms, new physical findings, new test results, we must be willing and eager to adjust our approach to the patient. The fourth criteria is our willingness to educate our patients. Being a patient is often very scary, especially in the hospital. We have a responsibility to help our patients through the medical maze and make certain that they understand, at their educational limits, what is happening and what we are doing. The fifth criteria is accepting our limits. We cannot cure every disease. We cannot always save a life. But we can always comfort. We can always strive to improve our quality of life. We can always care, and let our patients know that we care. We can always comfort. And we understand that palliation is a success for the patient. Palliation helps a patient feel more comfortable and improves the quality of life but does not cure disease. However, even it's palliation care that was given, with the care you give, eventually the patients become more cure himself. So now, let's see how you can be a doctor in Malaysia. All our universities are affordable and fully recognized by the Malaysian Medical Council, MMC. Let's see as a student, what you must know about selecting a university. First, your entry qualification. You must have a minimum of 5 credits in SPM with BM, Maths and 3 science subjects must have a combination of as below. Grades BBB, ABC, or AAC in 3 subjects, biology, chemistry, physics or mathematics. Even if you have STPM or diploma in science-related studies, your basic qualification SPM still will be referred to join this MBBS program. So SPM is the most important one. For entry from matriculation or foundation in science or pre-medical course, you must have a minimum CGPA of 3.0, 5 grades B in biology, chemistry, physics, mathematics/additional maths, and 1 other subject in SPM, O-level or its equivalent. Normally foundation intakes space on universities. A general entry mainly on the month of May or August after SPM with a minimum of 5 credits and the same as the MBBS entry requirement. We can help you with the entry. Some universities give some percentage of discounts for foundation, where after the studies you shall continue MBBS with them. The next will be Medical Council recognition. You can check this on MMC website at www.mmc.gov.my. For MQA accreditation, you can check in MQA website at www.mca.gov.my/mqr. MMC recognized universities can be part to other universities outside Malaysia as it is recognized by a government body MMC, but yet you also choose universities that have direct recognition from Medical Council outside Malaysia, like Indian Medical Council, Sri Lankan Medical Council, or any other countries to give you an approach to worldwide jobs directly. However, when you enter that country you shall be advised sitting for a Medical Council exam for that particular country. Now let's discuss the third most important thing, which are loans, fees, and affordability. PTPTN for the B40 income group will support around RM 250,000, meanwhile for the M40 income group students will get RM 180,000 for the whole program. Based on this, if your MBBS tuition fees are RM 300,000, then the student has to pay the balance of RM 50,000 in cash, divided into 10 semesters. However, non-Bumiputra students can apply for optional loans such as Kojadi or MIED or Amar Foundation to support the balance. For Bumiputra eligible students, they can apply for Mara loans, and normally all Mara loans are fully covered with a monthly allowance. Eligible students can ask for our help with the loan applications and we are pleased to help you. The last part where you have to look at is the facilities. Facilities are not vital, but it is important to give you an additional mileage for your studies. Facilities such as the anatomage table can show the virtual dissection of a human body in 3D motion. It can help students to learn in depth about every organ visually rather than read it in a paper format. You also can check on other facilities such as operation theatre, where students use a single core for every operation or share it in a group. Students also can find out on clinical on which part of Malaysia they shall be posted. Additionally, they can check on lecturers ratio, local versus international or education level of lecturers, as well as how the program will be delivered and what is the difference compared to other universities. Again, I'm saying that all this is not as vital important than the main three factors we discussed. Most students know the pathway to becoming a doctor, but there is also a pathway after becoming a doctor. Let me explain, starting from the first process, which is everybody has to complete a pre-medical course, for example Matriculation, A-Level, SDPM, Foundation in Science, after SPM. Next will be enrolling in an MBBS degree that's typically 5 years long. Undergo 2 years of housemanship, which is a compulsory internship for all aspiring doctors. Once you've completed your housemanship, you will be a qualified medical officer registered with MMC. If you want to be a specialist, for example anesthesiologist, gynecologist, pediatrician, you will first need to work for several years as a medical officer to gain experience. Once you have accumulated some experience as a doctor, you can pursue your postgraduate studies, which take about 4 to 5 years. Finally, once you've met the criteria to be a specialist, you can register yourself with MMC as a specialist. So now, do you want to become a doctor? Have you found your universities? If not, we can help you. Fees normally will be from RM 50,000 to RM 65,000 per annum based on your interest and affordability. We also can help you to apply for PTPTN and also Mara loan if you are a Bumiputra student. Based on our experience, we have selected several universities, and out of them, 5 will be the best affordable universities for students. First will be Manipal University, and now there will be no clinical posting in India after the second year. It will be done fully in Malaysia. Next will be Segi University. Clinical posting for Segi University will be in Sarawak. Also, they have a pathway of MBBS and do specialization in the USA, where all students can work while studying with a minimum salary of $12,000 per month. Only certain students will apply for these studies, as they can be settled in the USA after their specialization. Other than that, students can choose Masa University, where Masa University has a state-of-the-art facility and its own anatomy museum. Masa University is also listed in the FAMA World Directory of Medical Schools. Next will be CUCMS University from Cyberjaya and Lincoln University from Petaling Jaya. Both are good in terms of quality of teaching and affordable. Lastly, Quest International University from Perak and Padona University from Kuala Lumpur. All these universities have their own specialty. If you find it hard to select a good university, we are here to help you. Now if you are an SPM student, you might look for Foundation in Science leading to MBBS, and if you are having much higher qualifications, you may look for MBBS. Foundation intakes mainly will be done in May and August, and for MBBS or MD the intakes will be in September or October. We have vast experience helping medical students to complete their studies locally and internationally. Our consultation is totally free of charge, as we are hired by all these universities to consult any students that we come across. We also do loan application assistance, and we ask all students to sit tight at home and just WhatsApp us to get this free assistance. Please get the number shown here and WhatsApp us now for more details about MBBS in Malaysia. Thanks, and we shall look forward to you.